Hello, my dear friends. Welcome to Aspire32, and this is your friend Dr. Suresh Shenvi here. And today's topic is something new again because we have covered about opportunities in the United States a lot, and we are trying to cover more countries like Australia and New Zealand or maybe Middle East. But today we have another guest on Aspire32, and it is Dr. Sasha. Welcome to Aspire32, Dr. Sasha. So good to have you. So good to have you.
Pleasure to be here. Thank you for inviting me.
So let me introduce my viewers. Dr. Sasha here is just joining the residency in UK in the Cardiff University as for the degree of Endodontology, and it is in UK. So that is why I invited her on Aspire32. She has been really kind for accepting this invite, and she finished her undergraduation from Bapuji Dental, where I finished my post-graduation. And then she has been working. She was working in Glow for some time. She was also sixth in periodontics and so many other achievements. But today we are here to listen about her journey in the residency for endodontology in UK. So my first question, obviously, for you would be that why did you get this thought that let me go to Cardiff University and plan my endodontics there?
Right, doctor. So basically, I always had this plan that I wanted to pursue a career in dentistry outside India. So I started my search very early, maybe in final year itself. I started looking into my options, and I, found out what is the process exactly for, doing your further studies outside or just practicing dentistry outside. And there was very limited information. I came across your channel also in between there. But yes, so once I narrowed it down, the UK right now, it seemed to have like the state of the art technology, and they boast a lot about their education sector. So Cardiff is one of the top universities in the world, along with many other universities in UK. So I picked out the programs that suited me. I decided I wanted to pursue a specialization course, not just any course. So I wanted to pursue a specialization course. So I narrowed it down to those. And yes, then I made a list of all the colleges that were offering the program that I wanted specifically, which was the specialization 3-year master's course. And I applied online, and yeah, that's then it's just a waiting process from there.
That's really nice, Dr. Sasha. And I always feel amazed when I speak to a few students at undergraduate level that they have that vision in the early days of their dentistry that they want to go abroad, or they want to, they have that goal that this is what I want to do. You said in your undergraduation, you decided that you were looking for many universities. Of course, there would be some motivation. It is like many times what happens is students don't have an idea, right? Somebody will be there to guide them or mentor them. So how did this thought begin that I will start looking for the master's program abroad?
Well, I wanted to, practice a specialization anyways. I wanted to be a specialist. So when it came down to that, there were only a few options that were really like, feasible. That was either the US or the UK or maybe the Middle East, like Dubai. So the US, it had a lot more demands, I felt, and the cost of the course was also more. Dubai and the Middle East has a few courses, basically very limited courses, and yeah, that brought me down to UK. The education sector there is basically really good. I didn't have a specific mentor as such. Whatever I could find online, I just noted it down. I got in touch with a few alumni from the UK colleges through LinkedIn and these websites that were like it was really helpful. Whatever few pointers they could give me. So I used LinkedIn for that, but I didn't really have any other first-hand information. I had a couple of seniors who were doing the MPH program over there or oral sciences. Those are more like 1-year courses. So I did have first-hand information from them about how it is to study in UK and how easy it is to apply and what they were planning to do with that degree, and how were they going to do the ORE. So I had that.
So what is the requirement, primary requirement, if you want to apply for this master program in endodontics in UK?
If you are applying for a master's program, if it's a clinical dentistry 3 years program, then you would usually need to have, one is your BDS, and then that also they prefer you to have a first class and above. They also ask for 2 years of work experience and basic IELTS score of around 6.5. And after that, they just look at your overall achievements and your extracurricular activities, how many, after that is just a selection process. The basic requirements are listed on the websites of each college, but mostly it's just your BDS, IELTS, and your work experience of a year or two at least.
Yeah. And do you have any idea about the number of intakes in that university for per year for this course?
Sorry?
Number of admission. How many people do they admit?
Each course or each program has around 4 to 6 intakes per year.
That's very nice. Yeah.
So
that's very highly. It means it is highly competitive.
It is highly competitive, but that doesn't mean it's impossible. It's definitely possible. You just apply. Have a good CV, have a good overall. Be an all-rounder in your UG and try to do as much as you can extracurricular, and I think it all adds up, the small things. So it's definitely possible. But yeah, usually the intake is 4 to 6 per program per college.
Okay. And this duration, this course, because India, the MDS is 3 years. So what is the duration of this masters in UK when it comes to endodontics?
It's very similar. It's a 3 years course there as well, consisting of your clinical aspect as well as your lectures and dissertation and all these things, research methodology, everything. It's quite similar to the syllabus, I would say, maybe, but yes. The way they
so you have the same thesis and research, everything is
yes, the core modules seem to be almost the same.
Okay. We last, I think 15-20 days back, we released one podcast where one of our own colleague and student, she also did the masters from UK, and that was a blended program where they were not allowed to do any patient, but in UK as such. But when they go there, they would be taught on the models, typos, and then they can come back to India, and maybe they are supposed to do these cases and record and present it. So how is this course, how is this master's different from that master's program?
Right. So our program is a completely full-time program. It requires you to be in the UK. You need to be going for classes every day. I think it's 5 days a week. And there's a certain clinical part which you will be handling hands-on patients. But they might be having a period of general dentistry before you get into your specialization or before you directly jump into cases of your specialization. But it's definitely a hands-on course because they are training you to be a specialist in UK. So after this course is done, you will have that specialist degree, and you will be eligible for the specialist designation in UK. You obviously need to get your ORE done.
You are allowed to do patients in this course.
Yes.
Okay. And what is the visa requirement for if you want to get into? So you got the admission. I know it is too early to ask about the course and everything, but I'm sure you might have applied for visa and all those things. You must have already got it. So how did that process go?
So once you apply and your interviews are done, after the applications go through, after a couple of months, the colleges get together all their applications. They call you for an interview, and if you are shortlisted, and once your interview is done, and if they finally accept you, then they send you an offer letter. If you accept that offer letter, they send you something called a CAS letter, which has to be used at the time of your visa application. You will be applying for something called a student visa, which would be given for the duration of your course. And you apply with the UK Visas and Immigration for a student visa specifically. And you basically need the letter from the university. and a couple of other documents like how will you be funding your studies. You need to show proof of your financial evidence, your qualifications educationally, your undergraduate degree, and any other IELTS scores and everything. And that's basically it.
So when I applied to US visa, it was like we go personally visit to the centers where you have to appear in person and they will ask you these questions. Is it very similar for UK visa also, or do you have paper?
Student visas don't have any interviews as such. It's just an online process mainly, where you give all your details online. There is just one appointment at a scanning center called VFS. VFS, you have to go with your documents, they scan everything, and they collect your biometrics. And that's basically an appointment for your biometrics. But other than that, there isn't an interview. They will do everything from the immigration side. And then they let you know, I got my visa clearance after 21 days. So like 3 to 4 weeks, you will get your visa.
Okay, and how much, if you remember, how much is the visa generally charged? Because I think US visa costs, not student visa, tourist visa costs around, because US exams can be given on tourist visa. So it was around some 12,000, 15,000 when I applied for it. How much is the UK for student visa? For student visa, how much
student
is the
visas will cost you 36,000 something, 36,000 and change. So around 36,000 usually in INR.
Okay.
Plus you do have to pay a medical surcharge, which is like your health insurance, which covers you all your doctor fees and your medicine fees.
So that is must for even visa. If you want to get visa, you have to have the insurance initially.
It's done at the same time. You will be paying for your insurance at the time of the visa application. It's done together. So the same site, you do both the payments side by side. So the payment for the health insurance, yes, the health insurance, because my course is a 3-year course, it depends on the number of years you're taking. My course was a 3-year course, so it came up to almost 1.6 lakh.
1.6 lakh rupees. Yes. And additional 36,000, or that is
additional 36,000 for the visa itself.
So somewhere around 1.5 lakh rupees.
Yes. So this covers you for the duration of your course. But yes, having a student visa also gives you the opportunity to do the 2 years post-study work visa. So that you have to apply at a later stage, but you get an opportunity to work there for another 2 years.
Okay, so this is like the OPT which we get in the United States, where after the course you can 1 year or 3 year. So you have similar in UK also.
Right.
Okay. So how much this course, maybe including, if you must have already calculated the living expenses also. So how much per year this course might cost for any student in general, for suppose he wants to spend minimum?
So I'm talking about only the 3 years master's courses that are in UK. The range is between 38 lakhs per year. It goes all the way up to 55 lakhs. Those courses are the ones you find in London. In London, you have like colleges like King's College, Queen Mary's University of London, and even UCL. So these are very highly ranked colleges, and they are in London, so they do charge more as well. But the colleges outside of London tend to have lower fees. So you can estimate between
30 to 50 lakh rupees is a range
per year.
Okay. So I'm interested to know one very important point, that in US with a student visa, they have permit to work side by side, so that covers their at least expenses. Do you have something like that in UK for the students?
Yes, we do have a work allowance. So as students, we are allowed to work, but only part-time, which means only up to 20 hours per week. We can take up any job that we find anywhere. It doesn't matter what job it is, but it has to be within the allowance period of 20 hours per week. So a lot of students do take up this option, and they earn like a good amount of pocket money to sometimes even cover their accommodation costs.
Okay. How do the students generally meet this financial requirement? I'm sure that 30-50 lakh rupees. There are students, at my time I never imagined that I can afford 30-50 lakh rupees of education.
Yeah.
But now, maybe because of better financial situation, better earning, there are people who can spend 30-50 lakh rupees for education. But do you think that everyone who approaches for this course always does a self-finance, or there is an option for loan and everything in UK or in India, if you have any idea about it?
Yes, so scholarships are one way, but related to our specific branch, there aren't a lot of scholarships. There are a lot of courses or other programs that you do get a lot of scholarships for, ranging from 2,000 to 10,000 pounds per year. Uh, but our course specifically doesn't have a lot of college scholarships from the university side. There are maybe a handful, maybe 2 to 3 scholarships that we are eligible for, that we'll be competing with people from all around the world. So those, you do have to do research and start your research at least a year beforehand, because the scholarships deadline is at least a year before. So they close somewhere October, November in the year before your course starts. So do a lot of research about scholarships, but not a lot of those are applicable to us. Another way is definitely getting a loan. You can get a loan from Indian banks. I'm not very sure about the process, but there are definitely a lot of students who take up loans and then they pay them back as they work in UK. So there are a lot of student loans. They have some interest rates. It would be a good idea to discuss that with your bank and find out about that. But a lot of students do take up loans and study like that.
So what are you most excited about in this course in endodontics? What do you think it will be? Anything different in this course compared to the other colleges of UK?
I was mainly, I mean, in general, they are a very highly ranked college, but yes, they do have a lot of the state of the art facilities, and I'm not there yet, but I'm sure they have a lot of things that we haven't even yet seen or practiced with. So I think that's what I'm most excited to get my hands on and uh, experiment with. They do use they train their students with loops, rubber dam, and endodontic microscopes as a regular thing, which we don't really focus on a lot over here. But yes, that is just something very regular for them. So I mean, it's scary also. You have to quickly add up all these skills that they have been already using. But yes, it's quite interesting to have to get to learn all these things. So I think that's what I'm most interested for. And yes, definitely experiencing the culture and the city, and yeah, I'm very excited for that.
Yeah. I can feel the enthusiasm because I did my masters in cons and endodontics. So for when I finished my post graduation, I thought I have learned a lot, but then I came as a student, and then recently even I started using magnification. It is something which I've been advocating to my students. And of course, doing daily is a mindset which has to be cultivated to a student in their post graduation at least, so that they can do it. But yes, it is in foreign countries. Majority people, especially when you are doing a specialty endodontics, the magnification is a routine for them, and it is really exciting.
Yeah, I mean, even otherwise, it's never too late for anyone to learn all these things. There are so many resources everywhere.
No, learning never stops. Learning
Exactly.
never stops. That is key. So I think we have almost covered everything, but one last question which I wanted to ask you is that by doing this masters, because this is something which is very important, because we have done a podcast about ORE, which allows the students or practitioners to get a license to practice dentistry in UK, which I think almost take 2 years for completion. So what is the opportunity by doing this masters? Can they skip this ORE and directly practice in UK?
No. To have your license to practice, you do have to clear the ORE separately. So there is no shortcut around that. Your BDS gives you is valid to study outside, but it's not valid to practice. So to make that degree valid to practice, you do have to clear the ORE. You can do it anytime during your study period. A lot of people, when they go there, they have better access to the coaching classes, which are very tightly linked to these exams. So they tend to have an on-site hands-on experience with these coaching classes. So you can attempt the ORE anytime during your program and try and clear it. And yeah, once
And
that is cleared,
what is the other opportunity? How, because if you do international degrees, then in Middle East and all, because I know that I'm not sure whether you mentioned that you are currently in Dubai. I'm not sure. Do you have plans of settling in Middle East after doing this masters in UK?
It's definitely in consideration, because healthcare sector in Dubai is also booming right now. So in Dubai, the current licensing requirements for a specialist is your DHA exam for your BDS and your MDS plus 3 years of experience. So when you have a qualification from the UK, the specialist qualification from the UK doesn't require you to have those 3 years of experience. You can directly come in, but yes, you do need to clear the DHA exam. Any country that you are going to, you need to clear your undergrad degree for.
So I'm sure with this masters, I hope I wish you well, and I congratulate you for getting the admission in this prestigious university, and I hope that it meets your expectation. And please, if you are passionate about endodontics, then endo is a field where you learn every day, and there is no, there is every case will teach you something new. There is always exciting. I wish you the best, and thank you for coming on Aspire 32. Thank you for giving me your time.
Thank you for the initiative and the work you are doing also. It's very inspiring. Thanks.